All right, pollution levels in the national capital region don't seem to be showing any signs of getting better. But what worse is the fact that now we're not seeing any signs or measures to actually keep it under control as well. Questions have been raised on GRAP measures. Questions have also been raised on a lot of public physical health activities being organized out in the open. So where are we at? Are we at a point of no return when it comes to our health here in the national capital? Joining me next is Dr. Naresh Trehan, Chairman and Managing Director at one of the top hospitals here in the country, at Medanta, to try and understand, are we there yet? Sir, I'm trying to say this to you. As a journalist who's been covering the air pollution story for over a decade now, I feel completely helpless when it comes to the issue of air pollution. I don't know what more can be said, what more evidence can be drawn, what more scientific proof can be given to make people understand the air emergency we are in midst of. Are you as a doctor also feeling as helpless?
So the question is that you are feeling helpless. I think the whole public is feeling helpless because we are suffering in this gas chamber, and it happens every year, and it gets worse as we go along. Now the point is, what have we done as a public or as a administration to actually check this? So we know what the components are which contribute to pollution at this time when the weather gets inverted. Cold air stays low on the ground, especially when the sun is not out. So the only time the air lifts up and the air circulation takes place is when the sun is out in its full form. Now, so having known that this was going to happen, the only thing I can say is, one, we have to blame ourselves in the sense, the public, that we know it's going to come, but we do not say anything during the year. We should be agitating around the year and saying, what can everybody do? What the public can do, what the administration can do, what the industry can do, what the construction industry can do. All these things are important to understand. Okay. Now the question basically comes, we are in it again and nothing has happened. So you rightfully said you feel helpless, and most people are feeling helpless. I think that the more concern we show as a public and sustained concern, the more the action will happen. Now, it's
Dr.
not
Trehan, but
only
I
up to the
want to
government to do
interject
what
here. Yes, I want to interject here to say this. Do you really think air pollution is a problem which can have a private solution? People are
No, it can't.
leaving Delhi, changing their place of residence, uprooting their families, their jobs, their lives, just to move out of Delhi. We've got evidence of almost 30 people who've done that in a matter of a day. People are paying more even just to put air purifiers in the car, in their homes, choosing to work from home, taking lesser pay, moving to other countries. I think people are even braving it out, going and protesting in that bad toxic air, burning their lungs only to prove a point. I am not sure what more can citizens really do. But as a medical professional, I want to ask you this, for perhaps those who are still not convinced. Are you, in your opinion, are we now raising an entire generation of individuals who will not have fully functional lungs? Do you think that's
So
happening medically?
let me put a perspective for you medically. The first thing, there is a misconception that it only affects your lungs. Yes, lungs is the first target because you inhale the air. But these particles do get absorbed in the blood and travel to every organ. So we see, what do we see? We see in the elderly population, or if people who have lung problems from before, this is devastating for them because their asthma, their lung problems are precipitated to a level where they have to get hospitalized. So one, if you look at the OPDs of all our hospitals, they are full of patients who are complaining of who have lung problems, asthma problems, and things like that. Second is the basic thing is that there is an increase in heart attacks. there is an increase in headaches, there is an increase in blood pressure, and more importantly, it is affecting the children because of two things. One, their development of their lungs and different organs, but more importantly, their neurological system does not develop as well if they are exposed to sustained pollution like we have today. So,
Hmm.
for everybody's sake, including our children, most importantly, because that's the generation that's going to take our country to the next steps, we must do something quickly. Now,
Got it. You said OPDs are going up. I want
if
to
you
understand,
remember, there has been a sustained.
compare it to, sir, 5 years ago. Do you think the uptake in OPD and in patients is higher or lower, say, just what we were seeing 5 years ago?
No, it's incremental every year because more and more lungs get damaged and then it accumulates further. So there is no question that it is that the pulmonologists are reporting in our hospital also. There are 3 times the number of outpatient visits today than they were in when the weather was better in the summer. So we are saying that there is a definite contribution, or not only definite, but a devastatingly high contribution of pollution into our health, and in every way form it is affecting us. So now, like, if you have a choice and you can leave the city, you should, no question about it. But for those of us who have to work here, or the children have to go to school, then you can't uproot them. So the solution is to stand our ground and try to mitigate this problem. Now,
Got it.
every day, what should be done? What should be done? So it is a collaboration between the public and the government and the administration that we must find the solution. Now we know
Yeah.
that 20% plus is being added by Perali burning. We know this becomes the worst time of the year in the last 2 months. There have been several solutions developed for that, including biogas, including making it into a product by collecting it into industry. There are the farmers say that we burn it because it costs us money to and we can't afford it. So they are saying it
Got
costs
it.
3,000 rupees per acre. No, those are
Yeah.
all
Yeah.
solutions that can be worked out, and I think
Yeah, I
that
think the
they will be
solutions are
enough.
pretty much there. They've been discussed, they've been spoken about. What's required is implementation. I think that's where we are when it comes to the air pollution journey. But Dr. Trehan, I want to ask you another fundamental medical question. The damage that happens to your body, not just your lungs, like you said, to your brain development, to your arteries, to every organ in your body with air pollution, is that irreversible? Is air pollution causing irreversible damage to our body and we are at a point of no return from there?
So this I have demonstrated many years ago and year on year, and I see it on a daily basis myself, that the difference between the lungs of people who live in Delhi and lungs of people who live in the mountains. Now, there is this charcoal that deposits into the lungs, gives a permanent blackness to our lungs. So the particles don't go away anywhere. Some of them get absorbed in the blood and some of them get stuck in the lung. So that's why progressively, as you go on, more and more lung tissue is going to get affected. So this is not a problem for just which is temporary. It is
Yeah.
accumulative, and you will see that lots of people have developed lung problems when they would not have if they didn't live in environment like this.
Yes. Sir, last question really. Despite all the awareness that we are trying to bring continuously every day for years now on the issue of air pollution, you see marathons, you see walkathons, you see cycle races being organized in this 400, 500 AQI. What do you have to say to those who are A, participating in this, and B, organizing massive physically challenging exercises in this terrible toxic air?
I don't think it's a good idea at all. I think it's a very bad idea to organize. And I don't think people realize it that this is doing permanent damage to them. So I would caution everybody against participating in an environment like this. And if the races are to be held, maybe they can move out of toxic areas and do it there. So it's not a good idea, or it's a very, very bad idea, I would say, that these things are organized at this time, which is causing damage to everybody's lungs. You may not realize it when you're young, because the damage is cumulative and it takes time to build up. So you may not realize, but your damage is being done without realization.
Right. Uh, then, as my parting question, Dr. Trehan, I want to understand this. If you could do one thing, or you could say one thing to Delhiites today who are still perhaps not convinced. They're saying, oh, it's our body, it'll adapt. It is bad, but not that bad. We are hearing some politicians say that. We are hearing some people on the ground say that as well. What is your response to them?
Absolutely, wake up and smell the coffee. It's right around you everywhere. You may be living in an artificial environment where we have air pollution control in our homes or in our cars or in our offices. That's not the answer. The answer is, what about the people who are exposed to it, who have no choice? If we can't be selfish about life, we cannot perpetrate this whole thing on other people because we think we can protect ourselves. How many people can afford air purifiers at home? How many people have to work outside just to make a living? So it's all damaging the whole society, and anything that causes bad health is bad for the country. It's not good for the economy, it's not good for the health of the country. So I think it would be very selfish to say, no, because I can cope with it, that I'm okay. That's terrible. I think that's a very, very...
All right, Dr. Naresh Trehan over there, Chairman and Managing Director at Medanta. Thank you so much for joining us.
Okay,
right.
bye-bye.
Thank you, sir. We leave it there for the moment. It is irreversible damage that toxic air breathing does to you, to the health of all adults, children, and elderly. So think about that next time you step out without a mask, or you think or even question toxic air.